Hi, my name is Megan Neeman. I'm a certified athletic trainer, and I want to share with you some information about how to care for an athlete with a potential broken bone. There's two different types of broken bones that someone may experience. The first is an acute fracture, which typically occurs as the result of one specific incident or trauma that produces enough force on the bone that causes it to break. The second type of broken bone that you may see is a stress fracture, which is usually the result of a repetitive type of activity such as running, which when it occurs one time is not going to be enough to cause damage to the bone, but over time, when you look at it cumulatively, may cause trauma to the bone, which will cause it to crack. To tell if a bone is broken for an acute fracture, there are a few things you're going to want to look for. The first is going to be whether or not the bone has an obvious deformity. If you feel the bone, you may be able to feel it shifting underneath the skin at a place where there should not be a joint. And the athlete may also complain of extreme point tenderness at one specific spot along the bone as opposed to a more diffuse amount of pain. For a stress fracture, you'll typically see the athlete complaining of pain or aching or throbbing pain right after they get done with activity, pain just at rest when they're not actually doing anything on it, and pain that may wake them up at night. If you suspect an athlete has an acute fracture, you should splint the area and send them to the hospital for x-rays. If you suspect an athlete has a stress fracture, you should make an appointment with an orthopedic doctor as soon as you can. Once a fracture has been diagnosed, the doctor will have their own specific protocol that they want you to follow. Whether that could include, usually it will include immobilization, but whether that immobilization is in a cast or a boot and the length of time that they're immobilized is all going to be dependent on the doctor and the specific type of fracture. If you have any more questions, please ask your certified athletic trainer or your doctor. Thank you.